we can call it that. The plan is basically a 45 to 50-minute conversation on what we can learn from German preparedness around its national healthcare and innovation policy. Is Fabian coming? Does anyone know? Okay, so I guess Fabian probably is not coming. We can go with our whoever is here, and we can follow the sequence that I had emailed. The way I will start is I will start with Professor Leidl, then go to Professor Harhoff, then come to Professor Carolin, and then wrap up with George, Professor George, if that's fine. Okay, awesome. So I will give me 1 second to open up the sequence. And the plan, after we record this, we are going to socialize this on our social media channels and also on our Healthcast handle, which we have for the podcast for this particular session, and share everything with you guys and tag your respective institutions, etc. Just 1 second. Speaking points. Yep. Okay, cool. So I'll say 1, 2, 3 and start off. Is that fine? Okay. 1, 2, 3. Good evening, everyone. Thank you, everyone, for joining today in this digital roundtable, which we are doing as part of Healthcast, the podcast series from the Center for Management of Healthcare Services here at the Indian Institute of Management, Ahmedabad. Today, we have a very distinguished set of panelists joining us from Germany, sharing with us the lessons that we can learn from the national healthcare and innovation policy and preparedness that Germany has undertaken to work with COVID-19. We have Professor Dietmar Harhoff from the Max Planck Institute, Professor Leidl from Munich, Professor Georg, and Fabian as well has now joined. I can now see Fabian as well, and Professor Carolin from University of Passau. The plan is basically to go around the layout and have a conversation on what has Germany done, what can we learn from Germany, especially for high population density hotspots like South Asia, not just India, but this entire region, Pakistan, India, Sri Lanka, Bangladesh, and Nepal, probably is one important area to keep an eye out in terms of how they should plan their COVID-19 response going forward, because cases are spiking in high density population areas. So without further deliberations, let me come to Professor Leidl and ask him some questions in general about Germany's public health response strategy. He has been doing some studies in Bavaria, and also he has been working very closely as a premier health economist in Germany on the German response on COVID-19. So Professor Leidl, if you can share your overall thoughts and lessons from the German experience for South Asian hotspots, how to prepare going forward on COVID-19, that would be really helpful. Over to you, Professor Leidl.
So thank you very much for inviting me to this fascinating discussion. I'm very glad to contribute. I must admit that I am very glad to inform you about some developments in Germany. It will be another question, I think, on how well that would fit on the specific challenges that you have been mentioning already. I would give 3 little points for the discussion. First, starting out with a very brief history of what has happened in the first 4 months in Germany this year. Actually, it was a very special situation because we started out with one infection that could be identified exactly as a Chinese visitor in a Bavarian enterprise has infected 14 people, and that could be exactly observed, and the person had left afterwards, and so it was very well known who has carried the infection. It was clear that it's the infection. Everybody thought we're wonderful in handling that, but that's a fully unrealistic case, of course, and it turned out that in the month of February, there is vacation time and many people went skiing in Austria and part of northern Italy. And there we had the coming in of infection at various places and developments. Then actually in March, we were observing not only in Bavaria, but throughout in Germany at some places, very strong growth, more than what China had reported, for instance, in terms of unrestricted growth rates. And the second aspect, which was soon visible, was that the cumulative fatality rate was very low. And I will come back to that in the framework conditions, which is probably linked to quite broad testing already. So the enumerator, if you have deaths related to people reported infected, was in international comparison presumably quite large. However, we don't have really comparative data on that. And in March, we then faced a lockdown, which was quite broad and strict and seemed to work well. So the infections went down in April quite strongly. And now since about 10 days or so, we also have very clear economic pressures to open up again, and the first measures have already been taken. So, as I already said, what are framework conditions as a second point that contribute to that? I think the strong office-based system of outpatient care in Germany has allowed to have a very broad approach to testing. And in the hospital field, we had during the lockdown very strict regulation that, for instance, elective surgery could not be performed anymore. And hospitals all had to redirect themselves to the COVID-19 response. As a consequence, we had, I think, no capacity problems so far, with already a quite high level found in international comparison, for instance, in German hospitals. A contribution to that, by the way, I think also was that concerning intensive care units, a national registry has been established to fully inform how many beds are there, what types of care are there, what are the occupancy rates. That has helped a lot, and also to see that not yet any capacity restrictions had been met. Another important point in the German system is related to the federal conception that at a state level, you have different policies, and prevention is in the responsibility of the states. And another point, I think, which is important for the acceptance of the prevention is that quite soon economic measures were accompanying the prevention measures, such as special rules on wage support from Social Security for businesses that lost their revenues, and also loan programs for these firms.
That's a great point.
So in research, we still have large uncertainties. We have some seroprevalence studies started, including one in Munich here, which has a longitudinal concept in order to follow the developments. No results available yet, but it's aiming at collecting data from 3,000 households, and I think quite a part of that has already been reached. Also very important is research in terms of diagnostic tools. And summarizing all that, I think important learnings could be that we have a clear commitment to scientific evidence.
I'm very glad you say that. Yeah.
We are working on improving the database, such as on the ICU aspects. We have a very committed political leadership and broad discussion in the society, both helping a quite open-minded approach, I think. Digital communication, the shift, for instance, what we're doing now in the universities, that has been exploding, I think, in terms of use. And we do have also some specific information campaigns regarding workplaces, public transport, and other issues. Key point, which is difficult in Germany, I think, is recognizing the networks where infection is really taking place in order to cut that down, not only at the general level. And at the moment, there are discussions about avoiding the prevention paradox that people think we're already over, but we can't be sure we are. We really are on the declining side. And of course, the economic outlook is devastating currently, so that will be a very important point. And I also think what is not yet so visible, we have a strong social security system, but still disadvantaged groups will suffer more, and it's very important for policy to direct their attention to these disadvantaged groups. Thank you very much.
Thank you, Professor Leidl. I think you have made some very important points, and what caught my attention especially is the coordination that is happening at the national and provincial level, the importance of respecting science, evidence, and data, staying clear of the prevention paradox and identifying contagion networks, and also overall the theme of recognizing that innovation is an integral component to use as an engine to control COVID-19. And that takes me to ask Professor Dietmar Harhoff. Professor, you have been working with Chancellor Merkel for some time now on the national innovation policy in Germany. Could you share, I mean, there are conversations on diagnostic tests, innovative policy mechanisms, vaccines, and all kinds of other therapeutics to treat these COVID-19. Could you just share with us what is the national level thinking right now at the innovation ecosystem level in terms of the German innovation response, science and innovation response that's coming through, from which, let's say, less resource constrained and more science resource constrained settings like India can learn, and some overall thoughts on how innovation policy in Germany could be a great benchmark for the rest of the world to work with COVID-19 to complement what Professor Leidl just shared on the healthcare policy level. Thank you very much.
Thank you. Thanks for having me. It's great to follow up on such a great introduction by Reiner Leidl. Thanks, Reiner, for putting us in the right frame of mind. Just to tell you where I am, I'm in my home office, which is 900 meters away from the location of the first outbreak in Carolin at the bus stop. So this thing initially was very personal because we weren't quite sure with the kids or the parents that had been afflicted by the virus, to which schools they went and so forth. So instantly you start thinking about this after watching for some weeks what had happened in China. Fortunately, as Reiner has pointed out already, there was a very, very strong and fast response to that outbreak with case-based follow-up of the infection paths and so forth, something that we couldn't afford anymore after the number of cases had gone up. So permit me to show you briefly something that I programmed some 4 weeks ago and which gives a relatively clear picture by now, I hope. No, actually.
You can share the screen. Professor Harhoff, did we lose him? Something may have happened to the internet connection. So if everyone is okay, maybe I can continue. No, he's there. Oh yeah, we lost him. So we can go to Professor Carolin and then come back to Professor Harhoff in just a bit when he's back online, if that's fine. Yeah.
Okay, thank you so much. I'm delighted to be part of this and be now the second speaker. And I will talk a bit about a study of clinical trials I have been conducting with our biologist Anne Asmus together. And I will later explain why some of these insights may also be helpful in the trials that are now undertaken to target the COVID-19 virus. So maybe let me first explain why we started this project. Two observations were highly important. The first, particularly in the last decade, clinical trials have become more costly, more time intense, and at the same time more risky. Yeah. The likelihood of a drug to fail increased enormously, particularly in stage 2 of clinical trials. So that's the first observation. The second observation, at about the same time, the pharmaceutical industry increasingly outsourced trials to clinical research organizations, so-called CROs. And we were wondering to what extent these two observations may be connected. So we decided that in order to understand this better, we need to go to the people who are undertaking these trials, and these are the so-called principal investigators. They design the trials and so on. And we wanted to find out to what extent their kind of skill set is related to the success of these trials. To give you some background information, the challenge of PIs is a translational challenge. In drug discovery or the preclinical stage, the targeted mode of action is discovered, the drug is engineered, tested in model systems and in animals, and then in the clinical stage, the drug is applied to humans. So this is about turning the basic research discoveries from the bench to the bedside at the hospital. And we were investigating to what extent skills in basic and in applied research are important, and to what extent skills or experience in diverse fields, such as having experience in cancer or diabetes, impact this translational capability. We then built a data set with nearly 4,000 trials, of which about 60% are sponsored, initiated trials, publicly financed trials, and about 40% are industry-sponsored trials. So they asked the PIs to undertake trials with their drug they developed in-house or in a biotech firm. For both types of sponsored trials, the industry and publicly financed ones, we find that the likelihood of success increases when the investigators do not only have applied scientific skills, but also basic scientific skills. Yeah, it was an enormous increase. So having skills in basic and applied is important for this translational challenge. And the task of translation becomes much easier when investigators can apply the methodologies and problem-solving skills that are normally associated more with scientific exploration. But further, in both types of trials, experience in diverse fields reduces the success probability. So having done trials in, let's say, diabetes and cancer and cardiovascular is not good. It's better to concentrate. Why? It seems that the costs of dividing one's attention among various areas instead of concentrating on one are higher than the benefits of recombining the knowledge from the diverse fields. However, and this is highly interesting, investigators in industry-funded trials are able to alleviate this effect when they possess basic research skills. So presumably, in industry-sponsored trials, investigators will not have the possibility to share the knowledge broadly, and they will be under time pressure to conduct a trial in a short time frame to satisfy the needs of the drug manufacturer. In contrast, this is less important for investigators of publicly funded trials, as they have much more flexibility in terms of timelines, information sharing with their colleagues, debating the results of the trials, and so on. So what do we learn from this research for COVID-19? And there I would like to make 3 points. The first point, in Germany, and Reiner Leidl said this already, political decisions, the lockdown, and our own behavior was strongly guided by the advice of basic scientists. So strong basic research and also the trust in our science, scientific evidence, also this change from time to time helped us, I think, to cope quite okay so far with that virus. Second, I'm coming now back to clinical trials. Worldwide, nearly 100 new drug candidates are trying to target COVID-19. Recently, 7 new drug candidates have entered clinical testing. 3 are sponsored from Chinese institutions, 2 from the US firms, 1 from Oxford University in England, and also 1 from Germany, from BioNTech. And it's a very complex virus, and suggested by the results of our study, basic scientific knowledge will be highly important for the success of these trials. And now I'm coming to my third point, and that's sharing data, getting feedback, opening up discussions. I think that will be of utmost importance to be fast, because now it's really about being fast. In the last months, triggered by Corona, and I think Fabian will talk about this a bit more, we have seen an enormous increase in pre-publication sharing of results, which is quite important since we are all in one boat. And I mean, it's certainly a race who is coming up with the vaccine or therapeutic drug.
Yeah.
But I'm sure we are faster all together, and it's not a race between countries. It is like us against this virus, and no matter where we live or who we are, we need to share and build on each other very, very fast.
Yeah, and now that Professor Harhoff is back, I think those are great thoughts to basically craft the idea that it's the globalization of innovation that can help us in dealing with this virus overall. And I like the fact that you trusted your basic research. So Professor Harhoff, if you want to continue your intervention on how innovation and basic research and innovation policy is helping Germany in dealing with this, to build on Professor Heussler's comments on the clinical trials aspects.
So gladly, and apologies for the weak digital connection that I apparently have here. Let me make 4 points essentially on the response that I saw in Germany. And please keep in mind that this virus came upon us very, very quickly. Innovation machinery is slow. Yeah. So a lot of the innovation that we will see is now in the pipeline and will produce results, and Carolin alluded to that already, hopefully in the coming months, and less hopefully in the coming year. But there also has been a lot of innovation on the fly, community innovation, maker labs and so forth, that try to bring protective equipment and so forth into the economy. We saw quite a bit of that. And I think this has been greatly profited from the fact that this country, Germany, is still in a sense a maker country, where you have a lot of production capability. So we're also able to repurpose some of the production facilities, go into mass production, go into other protective gear and equipment. That was very important. The importance of testing has already been alluded to, and one of the puzzles for many international observers were, how was it possible that even just a few weeks after the outbreak, Germany had a testing capacity of 450,000 tests per week. We're now up at a level of 750 to 850,000 tests per week, and this is probably going to build even further. And I think, without getting into the details, this is a combination of the decentralized laboratory structure that we have, but it is also, and this is quite interesting, the available of the fine chemicals and the reagents that were used in those tests, for which this country is still in many cases a producer. I would have expected personally that the United Kingdom would have had a great chance to sort of show the advantages of its highly developed biotechnology industry at that point, but somehow that turned out differently. And apparently, this is a research question that we should follow up on. That is actually quite interesting. Reiner already alluded to the economic measures, which also helped to maintain innovation capabilities. But of course, in the first round, the economic measures were geared towards the large firms. They were geared to short-time work, which gave workers 68% of their wage levels, even if they stayed home, and thus protected worker-employer relationships. And then, of course, there was a lot of, by the way, with the help of the European Union, which has to sign off on any of the state aid measures that were implemented, and it did so very unbureaucratically and quickly. There were also quite a number of measures, loans and so forth, and there has been a package for startups now announced on the order of 2 billion euros to make sure that the sort of scarcity of funds going into the fund of funds and the venture funds does not harm the startup scene in Germany. This will be a very critical one. This is something that was initially overlooked, I think, in economic policy in Germany, because our focus is very often towards the Mittelstand, the small and medium-sized companies,
right,
the large producing companies, but less so to the startups. Last point on innovation that I would like to make: Corona crisis has been something like a digital nudger for this country. You may know that in all rankings that have to do with digitization, Germany was not necessarily in the leading group. If you look at e-government, if you look at the use of digital means in schools, in universities, in firms, and essentially, suddenly, all of these actors and institutions were forced to use it. And lo and behold, it worked, right? It worked badly in some contexts. It works nicely in this context. It works nicely in public administration, where suddenly video conferences are possible. People refused before or thought they weren't safe or whatever. I'm not saying that everything is perfect, but there has been sort of a forced digitization, sort of an innovation step that was not anticipated, which I think is very important, and we should make sure that we maintain that. Let me conclude by saying that there are probably at this point fewer answers than there are research questions. We know that some things worked well. We also see that other things did not work well. We followed initially, there was this little ugly scene where there was an export ban on protective equipment to other countries that was fortunately taken away. And since then, Germany has been exporting a lot of equipment, be it respirators, be it masks and so forth, to other countries. And I think that is in the spirit of what Carolin said already. This is not, and this should never be a nationalistic competition for having it all and looking good. This requires a coordinated international multilateral response. It requires probably much more coordination on the antiviral research scene than we have had before. What this event has shown us is essentially that some people like Bill Gates and others have been right, that we could have been better prepared as a global community. And I think there is this lingering question, if this, first of all, continues for a while, we have to work on this, but also the next pandemic is somewhere in the making. And we don't know when. It's not exactly a black swan in the sense that we would not, it comes sort of out of outer space. We know what kind of event it will be, we just don't know when it will be. But we can be better prepared in terms of particular research areas and global coordination of that basic research and implementation of antiviral therapies and stuff like that. I'll close.
Thank you, Professor. Thank you. Thank you, Professor Harhoff. I think we are building on a nice sequence, starting with healthcare, going to collaborative global innovation and the role of public-private primary investigators in trials, to the complementary part of the economy that helps in keeping the innovation engine going, and even the conversation around digital nudging, which essentially tells you that some countries are more sticky than others ex ante to adopt GPTs, like, let's say, the digital mechanism. And also now is probably the right time to start thinking about, do we need to reevaluate how we should think about incentives for innovation? So Fabian, who is also at the Max Planck, has work on how data exclusivity provides incentives for biopharmaceuticals innovation. And I have been thinking personally offline, what is the new normal for intellectual property and incentives for biopharmaceutical innovation in this new world that we live in? And Professor Harhoff, you have rightly mentioned that a new pandemic could actually change the way we think about intellectual property and incentives for innovation. So Fabian, maybe I can turn to you and request you to build on the thoughts here and your work on data exclusivity and vaccines innovation, and share what you are observing in terms of how this is progressing. And maybe also, as Carolin alluded, some conversation on these preprints. There are a lot of preprints going around. So how do we evaluate the economics of science given all these preprints and the information that is there for share going back in terms of application to solve pandemics? Over to you, Fabian.
Okay, hi there, and many thanks for having me. Very important questions. Let me start first with the recent study that we conducted, me and my co-author, Stefan Wagner from ESMT Berlin, where we looked at to what extent firms' expectations about market exclusivity incentivizes their investments into drug development. And just like to keep it simple, like we find that the expected length of market exclusivity, which is the time during which the company enjoys the exclusive right to commercialize the drug, positively affects drug development outcomes. One important policy aspect here is that the length of market exclusivity is determined by two distinct intellectual property rights. First, by patent rights, which protect the novel features of the underlying drug, and second, by data exclusivity, which protects the results of the clinical trials that have been conducted to gain approval for that respective drug. Perhaps the most important distinction between those two intellectual property rights is that data exclusivity period starts at the point of drug approval and then lasts for a couple of years depending on the jurisdiction, whereas patent protection may start much earlier depending on when the patent was filed that protects the key features of the molecule, for instance. Data exclusivity may then become a particularly relevant source of market exclusivity when drug commercialization happens long after the discovery of the molecule, or where patent protection in general is quite uncertain. And here I want to add two more important aspects about data exclusivity. The one refers to what Carolin said. So to avoid misunderstandings, even with data exclusivity protection, the clinical trial results are disclosed and are there to inform the public. So competitors, generic companies, they do see the results of the clinical trials. This is completely independent of whether there is data exclusivity or not. However, data exclusivity means that the results cannot be used by generic manufacturers when they request approval for their generic counterpart of the original drug.
Mm-hmm.
The second aspect is, and I already briefly referred to that, is that data exclusivity regulations are very unharmonized across jurisdiction. Whereas patents have a uniform length of 20 years in practically all countries, data exclusivity lengths and also the requirements to gain data exclusivity differ from country to country. In India, for instance, you currently have 4 years. So there's a debate to extend that period. Whereas in the US, you can gain up to 12 years, in particular for biological drugs. So now, coming back to our common theme here, COVID-19. So how does data exclusivity play a role for COVID-19? So first of all, we have to understand that almost all of the drug candidates currently in development for treatment against COVID-19 have gained approval before for other diseases. This is great because prior approval means that it streamlines the necessary clinical trials because we do not have to make sure that the drug has fatal circumstances for the treated persons. But on the other hand, it also means that patent protection, at least the one coming from the primary patents that are filed very early, may have already expired. Here, an exclusivity period that starts from the time of approval for a given disease may be considered a further incentive to bear the costs of conducting these trials in the first hand.
Mm-hmm.
When it comes to vaccines against COVID-19, we have to understand that vaccines belong to the group of so-called biologics, which, in contrast to chemical drugs, which are based on clearly defined small molecules. Biologics are less easily defined and therefore patent protection is much less certain, at least in many jurisdictions. And it has been argued before that data exclusivity is therefore most relevant for biologics. Having said that, I think most economists right now agree that the market incentives are less effective for vaccine development than for classic therapeutic drug development. This has many reasons, like about where vaccines have been most demanded in the past, but also about the externalities coming from its consumption.
Yeah.
And therefore, like, governments are usually seen to have better chances to incentivize developments into vaccines through binding contracts, such as like the advanced market commitments,
Right.
or through innovation awards, which may not only award the one company who eventually successfully develops the vaccine first, but also maybe the runner-up, to make sure that firms invest in the first place and do not shy away just because they fear the competition.
Any thoughts, Fabian, on the preprints and the economics of science, or we can come back to that later?
Maybe you can come back to it later.
Okay, thank you. So to summarize till now, we have started with Professor Leidl laying out the healthcare policy environment in Germany. We went to Professor Heussler talking about the role of, now that biopharmaceutical interventions are coming, the role of clinical trials, public-private research, and also shared knowledge generation and transfer around the world. We came back to Professor Harhoff talking about how a national innovation policy framework is useful not just for our the innovation architecture that is there in public research, but also for startups. And in addition, the role of digitization in the economy going forward. And Professor Dr. Gaessler has now talked about how data exclusivity may have an implication for incentives for biopharmaceutical innovation and vaccines. And especially here, let's say market mechanisms may not be working, and innovation awards and advanced market commitments may be the way forward. Thank you, everyone. Now, this is a good time to bring in some history into the conversation. And Professor Georg von Graevenitz is joining us, and he has some past work on the global financial crisis. It's a completely different shock. It's not a pandemic, but it's a financial crisis which also affected the world across nations. And he had tested out some in his work how that impacted innovation. So Professor von Graevenitz, if you can share some thoughts on what you found there and what lessons those findings may hold for the current COVID-19 crisis, and how it might impact the distribution between basic and applied innovation. And the other thing I would like to take your thoughts on, because you are here, is because of the involvement you have with core economics. So how is economics teaching going to change potentially tomorrow post the pandemic, especially as a business school professor, and all of us would also be interested in knowing what is the new paradigm of economics teaching going forward, given your involvement with core economics. So Professor von Graevenitz, if you can share your thoughts, please.
Right, so thank you very much, first of all, for inviting me. And I'd like to try and share my screen. Let's see whether this works a little bit better than when we tried it before. Okay, so this is complicated now. No.
We may not.
Here it is, I've got it.
Yeah,
yeah, I've got it. There we are.
Excellent.
Yeah. So can you see the slides?
Yes, we can.
Yeah. So before I go into this work, which is joint with Dietmar, Harhoff, who spoke already, and a former PhD student, Antonina Garanashvili, who's now working in Bournemouth, I'd like to quickly highlight the key difference here, right? So in what we studied is the global financial crisis, which is a financial shock. Again, global, but still it's a completely different type of shock. And I think one key distinction here is that we have an industry here, the pharmaceutical industry, not just the drugs we've been talking about, but one thing that's been very important is personal protective equipment, respirators, all the hardware. And the key challenge in terms of IP here is that you have companies in place that have products they can sell, and they are now facing a distinct challenge. They could, for example, we have a German company that produces respirators and also personal protective equipment. They have IP in place. They could effectively share how to build these things, but what are their incentives in the face of this massive entry by car manufacturers and all these other people who are now going to help produce this stuff during the crisis? What is their guarantee that once the crisis is gone, they don't face these people in perpetuity. So that's a key policy challenge. I think there's a lot of thinking going on at the moment how to overcome this and how to incentivize companies like this to share anyway what's already there. But what we're looking at is a much so this is different. In the financial crisis, we didn't have that problem that much, I think. And it was much more interesting to see what the broader sort of ecosystem of companies that do R&D, what their response was. And we're going to look at this through the lens now of patenting. So let me just see whether I can move to the next slide. Yeah, there we are. So the first thing to notice was the crisis obviously happens in 2008 and 2009, is that there is a slowing down of patent filing, which wasn't, that's probably not surprising. What is more interesting, what you can see here in the graph, is that there's a very distinct response afterwards in terms of the picking up again, depending on how big the company is. So we split up all of the patenting firms inside the data from the European Patent Office into the largest patent filers previously, and we've got the different size classes there, and you can see very clearly that in terms of applications, at least, it's the very large companies that are responding most post-crisis and are starting to pick up again. So there's that raises questions. Are we going to see a concentration of innovation activity in the already sort of very large and well-funded section? And also a question of what is going on? Why is this response looking like this? So we dug a little bit deeper, because it's not just the filing that's interesting, it's also the patent stocks that are interesting. So that's the next graph. Here you can see how the stocks are responding, and this graph is showing you the hazard rate. So the probability that the stuff that is currently still alive is going to lapse. Yeah. And what you can see in the black line is that there is a spike in 2005, which was due to reforms at the European Patent Office that I actually didn't know anything about until I started doing the work. And then you see the crisis. You see that lots of patents lapse. And this is simply due to financial constraints. So there's a very nice survey that WIPO ran at this point in time, and they asked the companies, and some subset of companies found that they had to economize, not just in terms of all the other things that the companies do, so travel was restricted and all these kinds of things, but they also went to the IP section and said, you guys need to cut down on costs as well. Right. And so that's what the companies did. They let some of their patents lapse. And the interesting question then becomes, well, what happens if all this innovation goes into the public domain? Is this, so we are seeing innovation that is being opened up for follow-on innovation potentially. Exactly. So the interesting question, at the same time, obviously, as the economy itself is producing less of an incentive to do this. So there are countervailing forces here. There are forces that increase innovation, but there are forces that work against it as well. Yeah. And so the last thing we do here, this is a diff regression where we're looking at who is letting things lapse. So the dependent variable in the regression that underlies this picture is who is letting the patents lapse. And the identification here comes from the fact that companies are themselves exposed to rivals who are better or less well financed. And we're looking at the rivals here who have access to the bond markets. It turned out that if you had access to US bond markets prior to the crisis, it was much easier to finance your way through the crisis than if you were dependent on bank loans. Now that's obviously specific to that particular crash, that crisis. And so the picture shows very clearly that the more you're exposed to these well-financed rivals, the more likely the companies are to drop their patents. So it's really this financing response. Now, obviously, in the current situation, we have no idea yet what's going on. This is going to be very difficult to do anything real time, but it's quite likely that we have a similar response in the sense that the financial strain that is there for all companies now is huge. The demand reduction is massive, and as people have indicated, during the financial crisis, there was actually a fairly massive intervention of the Chinese government that really pushed the Chinese economy to expand. So that helped at a global level, even if nobody much talked about it at the time. But we don't have that right now, at least not immediately. So this is going to be a big question too. Right, so that covers generally the, the kind of responses we can expect. So there are some positive things. It's possible that there is quite a lot of opening up of older kind of IP that could become available. But of course, there's a big challenge. Where is the money going to come from to fund all this follow-on work? That's something governments will have to look at, because they will have to incentivize this. Okay, so I think that finishes that off, and I can move on now to core.
Economics teaching,
Yeah. Okay, so I've got one slide here with a link. So core is a group of people who got together several years ago to produce an open source online economics textbook for people who start studying economics. Mm-hmm. The idea was to include a much broader range of topics than you might find in the existing books. And as I said, from the beginning, these authors include people who are teaching in India and Bangladesh, for instance. So we always aimed to produce something that was accessible to anybody. As long as they had an internet connection, the materials are accessible. And this is really the kind of the very core of this group of people who are working still on this project and associated projects, have responded incredibly quickly to this crisis now, and have produced a bunch of materials that I think are quite interesting and worth looking at. So I've listed them here. There's the article by Arjun and Joe Stiglitz and a co-author on the patent system and the pandemic. And there are related to this on the website. You will find a bunch of questions that are directed at students of economics who can kind of try and work their way through the logic. You might not agree with the article, but at least you get a bunch of things to think about and links to the book so that you can fill in knowledge gaps. There's a presentation put together, I think, by Wendy Carlin, who is one of the key people driving this project, on the macroeconomics of the pandemic, with lots of information about all sorts of aspects of it. Again, referring to the framework she uses in the book to help people understand how the macroeconomy works in an open economy. So that's going to be a useful resource. There's a very nice exercise using data from R that's freely available. That's the Johns Hopkins data that Dietmar was also going to show us. And they take you through step by step on how you work with this data, and also the limitations of the data. So that's a key, it's a useful thing. And then the final resource is a lecture by Stephen Wright, who takes you through this infection model that's being used quite a lot now at the moment to model how the infection is progressing. That's it.
Excellent. Thank you. So maybe this is the time to just wrap up the conversation and come back to Professor Leidl. And every one of you go around the digital roundtable and check like a one sentence overall message for the audience, everyone who is listening to us about, remember the title. So the title was, what can we learn from the German national healthcare and innovation response to COVID-19 for the rest of the world? So Professor Leidl, Professor Harhoff, Professor Heussler, Dr. Gaessler, and Professor von Graevenitz, if you can just summarize in a sentence the overall messages that you can give to the audience going forward, that may help in wrapping up this conversation.
Yeah, thank you. I think it has come clear that we have a very complex and interrelated issue. So I think that several dimensions have to be combined, and that would include to generate the evidence needs and to really discuss them. That involves communication needs in order to make it understandable to all parts of the population. And then to have some main policy focus points, including, among others, the identification of specific networks, including also the accompanying economic measures, and especially important, the policies directed at the disadvantaged groups.
Thank you. Professor Harhoff? You're on mute. You need to unmute yourself. Yeah.
So I did unmute myself. Let me highlight two lessons. First of all, I think a combination of solid and well-working research institutions with the possibility to turn some things into production quickly can be extremely helpful. Now, what we also learn from that is being dependent on national capabilities should not really what we should strive for. So I think we should learn how to coordinate internationally distributed capabilities better and how to bring them to bear quickly to the hotspots that have been shifting around for a while. The second point that I think is extremely important is that we think very carefully about measurement. Measurement is extremely important in coming to the right policy conclusions. And we know that even up to today, the data that we get is imperfect. What does it mean to have new cases if you don't know what the basis was where testing was done? What does it mean to have a certain number for cases of death if there was no measurement in particular institutions or if particular cases were excluded? And that is still not being communicated to the international authorities or to the data collectors in a transparent way.
Yes.
So the databases that we have are highly imperfect right now, and that impedes prudent policy making. So I think that's where the learnings are the greatest for me. And towards the future, I think this pandemic pushes us to think very, very hard about basic rights like data protection versus detection of chains of infection and so forth. And however this one goes, I think we should use the intermediate time to the next one to get that right and to have the discussion and be prepared. Thank you.
Thank you, Professor Harhoff. Professor Heussler, your comments to wrap up.
So there has already been a lot points made. Let me try to add a bit, maybe 2 points. I think for Germany, it was important, and this was also learning to listen to scientists. Also, the broad population had learned to listen to science, to trust in science, and also to understand that science has not always immediately, specifically in that situation, an answer, and there may also be changes. So understanding a little bit more what science means, and the better the scientific basis, I mean, the better the subsequent political decisions. So sharing data, and this is, as I said already, it's a joint effort. So this is my first point. The second, I think COVID-19 and the Corona crisis, there are a lot of mechanisms put in place at the moment, but I think it should not deviate from, we should not deviate from our main efforts in trying to also target the big challenges, climate, inequality, and so on. So I think even now we may need to even try to since a lot of people had to react and are now in kind of a change mode, take that momentum and direct it in the right directions. And there, COVID-19 will be over at one point, and I think there are also these really big challenges that we should have on our screen.
Thank you, Professor Heussler. Those are great points. Dr. Gaessler, your thoughts?
Thank you. So of course it becomes harder and harder to add something about
I know.
what Germany is doing well, but let me just try to highlight 2 things. The first one is that I think it became clear that science plays a fundamental role even in the most rudimentary and basic aspects of our society, and that having a government, or at least particularly a leader that that is close to science and knows also how to communicate in a science way, more tentative and not raising false hopes preliminarily, may be a good thing. And I think that's what is internationally also appreciated. And second, I think that despite the current social distancing in the local sphere, that we all move closer together on an international aspect and an international dimension, in the sense that there will be more sharing of information, and that also certain distribution channels are emphasized way before something like this happens.
Thank you, Dr. Gaessler. Those are amazing points. And indeed, Chancellor Merkel has shown the way to the world how to trust in science and use scientific communication to guide policy making. Professor von Graevenitz, if you have any thoughts, finally.
Yes, yeah. So So I think, as somebody who lives and works normally in the United Kingdom, but who is presently in Germany, one thing that has struck me particularly about this crisis is the contrast between the healthcare system here and the healthcare system in the United Kingdom, and particularly the question of resilience. So the healthcare system in Germany has been often criticized for being particularly wasteful and for being expensive in comparison to the NHS, etc. And to some extent, that's true. The Germans were actually in the process of closing down small regional hospitals because they are too expensive. Yeah. But now they're suddenly discovering that actually having all these excess capacities is extremely helpful and is very, very useful. Yeah. Now, there's another angle here, which is even going beyond this, which has to do with the kinds of companies that we tend to focus on when we make economic policy. So I think we all, for a long time have been looking at Silicon Valley and the big companies that have grown out of this innovation ecosystem. And so there's a focus on this thing called the unicorn and the idea that the innovation system should, to some extent, seek to try and create these kinds of companies. But we're seeing in this crisis in Germany that the companies that have actually really been instrumental in getting the German response up and running have been mom and pop operations that are producing testing kits. These are really family firms. And it's surprising to see that. Yeah, it's that these companies are the ones that stepped up most quickly.
Exactly. Those are amazing thoughts. And I really appreciate your time, flexibility, and availability to do this. It itself reflects how much you care about your science and your work for general shared understanding and transfer of knowledge for everyone in the world, not just in Europe or Germany or in the developed part of the world, but even for us who are here in South Asia or in more resource constrained settings. Thank you, everyone. I really appreciate your thoughts. And my team will be in touch with you, socializing all the outputs from this conversation. Thanks again. Please stay safe and take care. And we look forward to having and hosting you in campus once things settle down a little bit. Thank you very much.
Thanks for having us, and thanks a lot.
Thanks a lot.
Thanks a lot. Bye-bye.
Thank you.
Bye.